Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to another episode of the Lunch and Learn with Dr. Barry. I am your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as Pierre Medical Consulting, helping you empower yourself for better health with the number one podcast for patient advocacy, affirmation, and education. This week we have a special guest. We have Dr. Yvette McQueen, who is a global physician on a mission to educate about health, travel wellness, and disease prevention. Guys, I think this is going to be a very interesting conversation that we're about to have, obviously, especially with what I like to call outside opening up again. A lot of the questions I'm getting from people who are fighting to really not only get out the house, get out the city, get out their county, get out the state, get out the country. And the question is always, how do I do it safely? And Dr. Yvette is an emergency medicine physician. She is a concierge travel doctor working as a physician across the U.S. as well as the Caribbean. She serves as a travel group physician, ensuring healthy and safe travel to her clients before and during international trips. She is a best-selling author, speaker, blogger, consultant, wellness and emergency care training, and international teaching physician for the American Heart Association. Pretty much she is an amazing doctor. You guys, you know how I like to do when I like to talk about myself a lot, but when I do bring guests on, I make sure they're phenomenal, and Dr. Yvette fits all of those categories. I can't wait for you guys to listen to this episode. Remember, if you have not had a chance, make sure to subscribe to the podcast, leave us a 5-star review. Make sure you get those description and the links to follow Dr. Yvette as far as her travels, pick up her books, everything that she's doing, you're going to want to kind of get behind, and make sure you send this out to not one friend, not 5 friends, 10 friends. Let them know about this week's episode here on the Lunch and Learn with Dr. Barry. Today's podcast is sponsored by the Lunch and Learn Community Merchandise Store, living out the motto, empower yourself for better health. And for the thanks of being a devoted podcast listener, I'm going to give you the opportunity to save 10% off today's purchase using the coupon code EMPOWER10. Go to shop.drbarrypierre.com. Use the coupon code EMPOWER10, all one word. You will save 10% off your entire purchase. Remember, 50% of all proceeds are donated to the 5-Star Scholarship Foundation, which is a nonprofit organization giving out scholarships for high school students. All right, Lunch and Learn community, you are in for a treat. If you listen to the intro, I know a lot of y'all like to skip the intro, but if you haven't listened to the intro, this is, I love bringing on amazing guests, special guests. And more importantly, again, I've talked about my journey as a medical mogul, and shout out to Dr. Dre. And one thing I do is I love bringing on other medical moguls to really kind of show, as a physician, all of the things and opportunities that are available to us that don't necessarily have to include, just being in an office or being in a hospital setting. Dr. Yvette, first of all, thank you for coming on the show. Thank you for, I'm excited, especially in a time like this, when things are kind of opening back up again. So I'm definitely want to get all your breath of wisdom again, Dr. Yvette. Thank you for joining the Lunch and Learn community today.
Thank you for having me. I feel honored.
So I do have a lot of people who do like to, for some reason, kind of skip past and, shoot past the intro, right? Because they like to get right into, I think they like skipping my little commercial or whatever. I don't know. I don't take it personal. For those who may have skipped it, right? Like tell them, who is Dr. Yvette? What makes you move, right? And like I said, we're gonna get into some of your business today, as far as everything that you're doing. But like who's Dr. Yvette? Like who should they know? Time said it that.
Yeah, so I am Yvette McQueen, MD, emergency physician, travel doctor, and wellness lifestyle coach. A global physician on a mission to educate about health, travel wellness, and disease prevention. I help travelers, executives, frequent flyers, professionals to stay healthy and well during their adventures and traveling experiences.
What's so interesting, especially when we think about emergency medicine, right? When we think about emergency medicine, I don't think a lot of people think about the aspect of prevention, right? I don't think it's something that really like comes into the forefront. Like, this is emergency medicine doctor talking about like prevention. Like what has kind of led you to this point here, right? When you get to the point where you're educating us on how to prevent us from getting sick, especially right when they may not be in the comfort of their homes.
That's because, what I see in the emergency department, I would say 60% is preventable. It really is. And I'm not just talking people thinking, trauma and accidents and gunshots. Well, that's not all I see. I see other things, of course, hypertension, diabetes, and I see people basically, I'm sorry, not taking care of themselves. So a lot of it is preventable what you do. Now, there's, of course, accidents and things happen and, people don't expect to have strokes. But as far as cardiovascular disease, keeping your blood pressure down, I actually sit down. A lot of people think emergency medicine is in and out. But I diagnose people with hypertension, diabetes, and I actually like to sit down and say, okay, now you have this diagnosis. These are some steps to actually manage it before you even see a primary care doctor. When it comes to travel, when I got into travel, I love to travel, have travel. I merged my medicine and passion for travel because I'll take you back. So when I was 14,
we hear this is I tell all my guests to come on here. This is your world. I'm here as the listener as well. Like, so you don't have to worry about it. Like, wherever play you want to go, we going with you.
Okay. So when I was 14 years old, I actually had a pen pal. This is back in the day when we actually wrote letters to people. I had a pen pal that lived in West Germany. And I'm dating myself because I said West Germany. That was when it was still divided. Wow. And it was off of the show. We had a pen pal. So when I was 14 in high school, I was able to go visit her. So that was my first international trip, my first airplane trip, and my first solo trip. I went by myself and I got the bug. I loved it. So throughout my career, I've looked at things that allow me to travel. So when I say I'm a travel doctor, as emergency medicine, I do what they call local tenens or temporary doctor, where I travel around the United States and Caribbean and work in different emergency rooms. I'm the substitute doctor. I'm the fill-in doctor. People lose contracts. I'm there. People on maternity leave. I fill in those shifts. So that way I get to travel, see the diverse United States, which is fabulous. So even if you can't travel internationally, you should travel around the United States. And that's how I merged my passion. And then as I started to travel for fun, sometimes I travel by myself and travel in groups. Well, it ended up being that, people get sick in groups. Who would they come to? We're like, wait a minute. 100%, I'm always fixing people on my vacation. I need to learn how to make this a career.
What's interesting? One, I love the fact that you noted that. Yes, I like traveling, but like, yes, we're not talking about always having to travel to Bora Bora and all these other different countries. Like the United States is huge. Like, you could travel across the country and still have an amazing time. So I love that aspect. And I think your explanation of it is so spot on of what an emergency medicine physician is. Because I think, I know these TV shows are out here, so they think literally the only thing that comes in a hospital is the person who stabbed themselves, or like, I think they think that's the only thing that comes in a hospital. But you'd be surprised. Well, I'm a hospitalist, so I understand like the amount of things that aren't necessarily emergent in the case, but enough that someone has to do the counseling. And because even as a hospital physician, especially when I was younger, right? My younger career, right? I used to get mad, like, the ER doc's calling me. But I understand that for every one person that calling me, they've already discharged like 4, right? Like which is still kind of crazy that y'all see that many people, but like, that's another conversation in and of itself. But like, so I understand like the amount of counseling that goes on. And that's why I want the lunch with me to really kind of make sure we pay attention to, like, ER docs do a lot of counseling and education, that don't, unfortunately, sometimes they don't get the credit, or not. Sometimes a lot of times they don't get the credit for it. I love your explanation of what you do, especially as ER physician. and look, that bug, right? Like just getting that first travel bug to say like, oh, I actually kind of like doing this is another thing. And now I'm talking to my medical students, my residents, those who think that, once they get into this profession that they can't do what they love. Right. Like that they have to like, all right, I'm here. I'm working my 9 to 5. I'm not going to go anywhere. I'm not going to enjoy my time. Like, no, you still realize like, I love doing blank, which especially in your case, which is the traveling aspect of it. And I'm going to keep on doing it. I'm not going to allow that. And with it's interesting. Dr. Erica's, she was locums as well too. So I love having, again, this, and Dr. Erica is a double board certified psychiatrist. She will be on the show as well too. And she talked about being locums and kind of that traveling aspect of it. So I love that we're getting, our physicians who aren't necessarily focusing and, staking ground and, being okay with kind of, really kind of seeing, really the world, especially here in the United States, as far as helping others who in areas that we may not be able to get that type of support from.
Exactly. And actually, people say, oh, well, how is it different? Because, I go from north to south. I'm out in New Mexico right now. And one thing I've noticed is everyone feels fear when they come in an emergency room. They're sick, something wrong. Everyone's pretty much the same. Everyone bleeds and everyone hurts and feels. So you treat everybody the same, even though there's going to be different dynamics, whether it's a farmer versus the lawyer. But you got to treat them all the same because guess what? The body is the same.
Yes. Ooh. So we talk about the kind of the maturation of kind of where you're at, and then kind of getting almost like an epiphany, like, you know what, I am always taking care of people, even when they're out traveling. Like, I need to figure out like what I can do to position myself to be there. Now, was there anywhere, obviously I'm an internist, I'm a hospital physician. So I have people I can look at and see like, okay, they're a hospital physician, they're a hospital physician. Like, did you have anyone you could look at to say like, okay, like that person kind of does like what I'm doing? Like, or was this kind of a road you kind of had to travel your own?
I kind of did it on my own. Well, when, as far as when it came to being travel medicine. So as far as locums, yes, I had some senior attendings that when I was a resident, I would see them and then I wouldn't see them. I was like, wait a minute, you've been off for like 2 or 3 months. I haven't seen you. And they were like, oh, well, yeah, they'll work a lot and then take some time off. And she's like, I was backpacking in China. And I was like, wait a minute, that's what I want to do. That's what I want to do. So I did 8 years of academic medicine where I had that shift and I worked for the university. And then I was like, okay, it's time to blossom on my own. And so I've been a full-time local attendance doctor for 12 years. So I control my own schedule. And that way I'm not messing up anyone's schedule. So when I do want to take a month off, because I've done teaching in Africa, done missions there, teaching in hospitals, put it that way, not teaching schools, teaching in hospitals and training, I can take a month off and go and do that. But as far as taking care of groups and travelers, no, I didn't have any guidance with that. I just kind of made it on my own. I studied. There's what we call the International Society for Travel Medicine. I joined that, took some courses. Some of it's emergency and wilderness medicine, and I teach that anyway. But I added a little more things like tropical medicine, and I went from there.
Can we talk about just this aspect? And I think this is a term that's especially going to be new for a lot of people in the learning community. This aspects of kind of wellness tourism. Like when you hear like that phrase, that term, what do you derive from it, and how would you kind of explain it to our community?
Okay, yeah. So wellness tourism, that is one of the hot areas of travel right now. Is actually growing, and it's a $1 billion business, believe it or not.
Oh,
wellness. Wow. Okay. Yes. So wellness tourism is not, and everybody think, oh, just wellness and travel. They think spa. You think spa automatically, and it's not. It's not. Of course, there are some resorts and say entities, hotels are now promoting wellness for their clients, whereas it includes nutrition part of it, actually changing their hotel menu so it can be more nutritious. And, a lot of people say, well, I'm going there and I'm gonna have the comfort food, but it's also going to be healthy. They have activities, or they've hired more activities, not just yoga. And people think wellness is just yoga, and it's not. They include things like renting bikes now or walking tours, bike tours, hiking tours. A lot of places will do that. And some of them you can actually get packages, whether it's relaxation or mental wellness, where they will have different ceremonies for you, or it could just be, healthy ones. So that's what wellness tourism, but it is hot. So there's like several, I actually am on the board of directors for the Wellness Tourism Association. So it's real. Wow. And it's in the United States, it's just really coming about, but it's been global in the world for a long time.
Now, has that been something that, especially with these resorts and especially the associations in itself, have they seen that need for like people who go on these vacations and who want to do more than just like sit back and eat? Like, has that just been like some growing need? Because I'm shocked by what you say, like $1 billion. Like you would think $1 billion industry, a lot more people would really know about it.
Yeah, I would say it's been growing in the United States.
Okay.
Over the last 10 years, maybe. Right. Like I said, the world has been there. I mean, people think, if you think back, we'll say, I'm going to have this wonderful medical spa, wellness, and they think of like Switzerland or Sweden or somewhere they're going to do that. Well, they've been there for a while, because a lot of people go to Bali. They go for that transcendental transformation. That's been around for a while everywhere, actually in every country. You can do it in Turkey. You can do it in India. You can do it. Actually, the number one spot is actually in Germany.
Interesting.
Actually, number one spot is in Germany. But yeah, it's been around. But yes, people are finding that they need to take themselves out of their daily life and look at other things, because that's the whole thing about wellness. Wellness is not just, people think, it's just the body and it's just how I eat and it's my physical. It's about your social. It's about your intellectual. It's about your mental. It's about your emotional. And that's what they actually combine a whole body experience for wellness.
And what's interesting, and I love the segue that we're about to go into it, is that especially when you think about people wanting to do more, we're getting into the summer months, right? Summer is here. And, obviously, and I definitely want to talk about your experience last year during kind of COVID and what that looked like really around the world. But more importantly, as outside, I've seen the term outside opens up again, right? Like people, and the question I'm getting, right, and I'm pretty sure the question that you obviously get, Dr. Yvette, is like what can I do, right, for really healthy and safe travel, like moving forward, like as we move, and I hate, obviously as an internist, I hate to say away from the pandemic, because the pandemic's still here. But people are trapped. Like they can't wait to get up out of here, right? Or just leave their locale, wherever their locale is. So I'm getting a lot of questions. Like, how can I do it in a healthy and safe way? Like, what would you use? What would you?
Okay, this is my favorite topic. Here we go. Healthy travel. Guess what, people? The only difference that I'm doing that I did pre-pandemic is wear a mask. So these are everything I did before the pandemic. So basically, you have to take care of yourself. A virus, and I'm sure you've gone over this, a virus. We can't kill a virus. It's going to be around. But virus, this one is, of course, passed by air. So healthy travel, first of all, so 3 things I'm going to tell you with healthy travel. 1, plan. You always got to plan. So nowadays with some things are open up, some things are closing. If you're crossing state lines, you need to know what the destination is requiring, because there's different requirements in Texas and New Mexico, and they're right next to each other. So you need to say the destination I'm going, whether the hotel is available, the capacity, the restaurants, what's their requirements. If I plan to go to museums, because a lot of museums in like DC was closed, or only saying you have to have tickets. And if you don't show up on your time, you lose, because they only want so many people. So those are things you need to plan for. Hawaii is a big one. Like a lot of people are going to Hawaii, which is the United States. Well, they require for you to have right now a COVID negative test within 72 hours, but you need to only have it at certain facilities. They're not playing certain facilities. You have to upload the information before you get there, get a little health form, have a QR code. And sometimes they won't let you board the plane, or if you land, they won't let you on the island if you don't have all the requirements. Two, since everyone's going there, people's like luau's are booked for 6 months in advance. So you need to plan right. They didn't have any cars for a while. It's a whole car rental problem. There was a car shortage. They had like moved all the cars off of the island during the pandemic. So they're getting the cars back. So rental car shortage. You have, and people can't book like their sunset cruises. Now you get there and wait to book it, you're just going to be sitting on the beach. That's pretty much it. So that's why you need to plan what you plan to do. Two, hydration. Oh, like you said, we're coming up with the summer months. You know what? You just need to hydrate for everything. All travel will dehydrate you, whether it's the plane, whether you're in a car, whether you're on a train, you changing your routine, you changing your activities. You may be out in the sun more. So the whole thing, hydrate will reduce the risk of blood clots. It will reduce the risk of jet lag. It helps to lubricate your joints. It keeps your skin moist during the summertime. And then what I do when I fly almost every week, like every other week, I do take my hand sanitizing wipes, whatever brand you want to use, alcohol, Clorox, whatever brand you want to use. They have been cleaning the planes a lot better, especially in the pandemic. They was like, oh, we clean the planes. They're starting to slack again. I'm watching them. But when I get on spaces, I do what I call high contact areas. The seat rest, the little button, the monitor, my seat belt, the window shade, and the tray, whether you pull down or pull out the tray. Those are things. And I did that before the pandemic. So
pre-pandemic, you were.
I did it. Yeah, that whole video of what was that model and she did. I don't do the seat covers, but I did it. I cleaned everything before. Everybody used to look at me funny back then when I did it.
They don't do it no more though.
They don't do it. They'd be like, oh, like a couple people like, can I have a couple of your wipes? Yeah, I always have extra wipes. And I'm going to tell people on the planes, don't put anything in that seat back pocket, because people have a tendency to put their trash back there, including dirty diapers, and they sometimes sit there. So you don't know, and I don't know if they clean down in it. So when you take your iPad and put other things in there, guess what? You're pulling up something. That's the one tip.
Appreciate that. Lunch Learning Community, I don't know if y'all realize it, but I'm mentally writing so much stuff down. I'm like, okay, all right. Like no more seat back. Like that's done. Like that's out of here. Okay.
Don't use it.
What I love is the fact that you mentioned this is pre-pandemic stuff you were doing. So like the stuff that the changes, all the things you're saying, it didn't really affect you because you were doing that anyways.
Right. And the only thing that is different, the mask. That's it.
Now the question I'm gonna get is, are you wearing your N95? Or are you wearing kind of like the regular mask, a little bit more available? Like what type of mask are you rocking?
Okay, so you gotta think pre-vaccinated and vaccinated. So before I was fully vaccinated, it was N95 double mask. No, N95 double mask, and I wore it at work. I would be just like I would be at work in N95. And then I would put another like surgical cloth mask on top. And I'm used to wearing it 12 or 14 hours. So my flights usually was like 2 or 3 hours. So it did not bother me at all. Post-pandemic, it depends post vaccinated, because we're still in a pandemic. It depends on the environment. I'll be honest with you. So when I flew the one airline, Delta, we're not being endorsed, the one airline that kept the middle seats the longest. So I felt a little bit more comfortable. And a lot of people it's not 6 feet. It was the number of people on the plane that really gets you. And I didn't feel crowded. I probably just wore the single mask then. Now these planes are packed. They're overpacked. They have children on there, people rubbing their nose, even though they're supposed to have their mask on. Because guess what? I've been diagnosing the flu lately. So as people are removing their masks, they say, oh, I'm vaccinated. I'm removing my mask. But people are forgetting there's other viruses out there, baby. There's other viruses. And a lot of people skip getting their flu vaccine because of COVID. So I've been diagnosing the flu and RSV, which is the child virus. Wow. It's high right now. It's high. So,
and listening to me, I don't know if you probably don't realize, and we're recording this in June, about to be July. You guys don't probably realize the importance of what she's mentioning, because we typically will as a hospitalist, I didn't diagnose a single flu during peak flu season.
Wow.
We're not even in peak flu season. We're supposed to be getting out of flu season. And Dr. Yvette is actually starting to diagnose more, which is, and I know obviously this ain't this type of episode, but that may be a concern, because those diseases that we used to be able to see in October, November, December, if we start seeing them in June, July, August, that's going to be very interesting. Wow. Okay. Very interesting. Very interesting. She dropped the bomb. She don't even realize she dropped. I'm like, oh, okay. That might be.
Right. Because, and I'm going to be honest with you, like you said, this is an episode we're supposed to be talking about travel, but the hospitals are full right now. The hospitals are full, and it's no longer COVID. Like the COVID numbers are going, but because people put off seeing the doctor or other things that we take care of, they're actually a lot of sicker patients. So the hospitals are pretty full right now in July, when this is, like you said, June and July, which is usually our slow season. Right. Wow.
Okay. All right. So that's something we have to keep an eye on. Lunch Learning Community. Dr. Yvette dropping bombs left and right on us. And again, we definitely need to keep an eye on that, because again, I got a lot of people who weren't getting that flu shot for sure. And of course, they try to use my words against me, because they heard that I said the numbers have dropped dramatically. But the reason why they dropped dramatically is because y'all was wearing y'all masks, right? But if y'all start taking them off again, right? Wow. Okay. Interesting.
Yep.
Interesting.
Yeah.
Now, did you have, especially, and obviously this is probably a two time period question, what were some of the fears people would have about traveling, especially from a health related standpoint, before the pandemic? And obviously I'm assuming the fears that they have now are probably situated around COVID, but what were the pre-COVID fears that, someone may hit you with, Dr. Yvette, I'm scared of this? What were some of those things you would have to run into?
Pre-pandemic, I think a lot of people would fear, one, if they didn't fly a lot, there's fear of flying. And basically when you get up there and you have your turbulence and, you get anxiety. But as the pilots like to say, turbulence is a natural phenomenon as you go through the clouds and everything, and usually under control. I tell people to watch the flight attendants, to watch the flight. If the flight attendants are sitting down, buckle your seat and sit down. If they're up moving around, even though you're bouncing around, you're okay.
Okay.
So
I like that.
And then if, some people feel with their flight anxiety, they need to drink alcohol. That actually makes it worse. And it also dehydrates you. Actually, it makes it worse. So if it's really to a point where you have flight anxiety, I say speak to your physician, and maybe they can give you some medication ahead of time to help you. But you can't mix that medication with alcohol. Please don't. I also say that and it still is one of the biggest medical problems when people are traveling, particularly internationally, is traveler's diarrhea. So people are usually was concerned about that. Can I go? Can I eat the street food? Can I experiment with the food? Should I drink the water?
Can I drink the water? Yes.
Can I drink the water?
There's so many like TV shows I see like, don't drink the water. It's got to be bottled. And like, is that a thing you tell people? Like, it's got to be the bottled water, or does that?
If you're internationally and you're in what I call a developing country where their water system is not up to par, and everyone thinks of Mexico, even though Mexico is not a development, but still some areas of Mexico, you should not drink the water. Don't drink the water. And you should drink bottled water or ask for like still water or sparkling water. If it's bottled and it's sealed, that's good. But also people forget about things like ice. Okay, you're going to get a drink. And it has sometimes I'm in Africa and they're like, you want a soda? Yes, no ice. I've learned to drink warm soda because ice is made of their water. You also should think of, I never eat lettuce or eat salads when I'm in those type of countries, because guess what they wash the lettuce with? The water. So if you can't peel that fruit or vegetable, if it's not boiled, if it's not broiled, and that's the thing CDC tell you, don't eat it. Don't eat it because they're using the water.
I love that. And I love how you hit us with the ice and the fruit, because that I definitely didn't even think about ice. I didn't even like that for some, like water 100%, but I didn't even think about like, oh yeah, go ahead, throw a couple ice cubes in there, and that just makes all the sense in the world, because again, where you think the ice is coming from?
Water.
Now, is that just because like our bodies aren't really used to their water systems? Is that usually what causes like a lot of this like diarrhea that we usually experience when we go out?
Right. There's a couple of reasons. One, it could be the filtration system of their water. So usually when people are in the resorts and things like that, they have filtration systems. And they actually, a lot of resorts would tell you, yes, you can drink the water. No, you can't because of filtration. The United States do have one of the best water filtration systems, except for Flint.
Yes.
As far as taking out the bacteria. So in other countries too, you got to think the same water source that they bathe or they wash their clothes in is where they're getting the water source for you to drink. So that's one thing. Or it could be you're not used to the bacteria of that land. Like a lot of people go to Thailand. Thailand is, if you're in the cities, they have the filtration system, but you may not still be used to the bacteria of that country, your GI tract. So it's not necessarily food poisoning. People are like, oh, I got food poisoning. Not necessarily your gut, just not used because they eat it and don't have a problem.
Right.
So maybe it's just your gut that's not used to it. So that's, people like to experiment. That's what travel is all about. But be prepared for, if there's traveler's diarrhea. And I tell people, if they have more than 4 stools a day, they're loose and runny, then they should seek probably medical care. I tell people, if you feel like you're having traveler's diarrhea, every time you have a stool, drink a glass of water so you can stay hydrated up, or of course the bottled water with it.
Makes sense.
Some people give people medication ahead of time. Some doctors give people medication. Be careful with that because there's been recent changes. Everyone, because I'm in a travel group, they'll be like, oh, I have my Cipro in case of my traveler's diarrhea. That's no longer the treatment. That's no longer, according to the International Society of Travel Medicine, that's no longer the treatment.
Oh, I love it. And obviously now post-pandemic, everyone is, fearful and scared of COVID, right? I guess I'm assuming like that's such a big like COVID.
They're not fearful. If you see these planes, if you see this airport, they're not fearful. Evidently, they're not. They think it's over with. They're done with. Some people, no, I don't even get questions about, last year I did get questions about
I'm so
COVID.
glad you said that, because I was wondering, I'm like, are people even afraid of this anymore? Like, is this wow.
No, they don't. Unfortunately. Of course, if you vaccinate, that's great. But, you got to think we're not all vaccinated. What, about 61%, 62% of the country?
Yeah, and that's just the country, and they're traveling to areas that don't have, even the ability, right? Not even don't, because we got a lot of people who don't want to get vaccinated, but even the ability to vaccinate it. I see a lot of U.S. citizens traveling to those type of areas, and of course I go crazy.
Don't do that, because their healthcare system. I tell people, one of the part of my planning is look at someone's healthcare system. Even if you think I'm going to the Caribbean. So I last year I did work on St. Croix. So that's one of the U.S. Virgin Islands. So that's a U.S. territory. They have healthcare. There's one hospital per island. They have a healthcare system that will not be able to take an outbreak. Maybe 8 ICU beds, maybe 10 in one hospital. So if you're dumping, and that's the whole thing about the cruise ships. The cruise ships, please don't come after me, cruise lines, but they're carrying, they say half capacity. So the biggest ship carried 6,500 people. So if you do a half capacity, you're still carrying 3,000 people to an island. The healthcare system that if you bring COVID, even though you say you test everybody, there's people that's been missing it. Then you bring COVID to that island and you interacting with all the staff, the taxi drivers, all that. You leave. Now COVID is upticking on this island, rampant, and their hospital is overwhelmed. Guess what? It's hard to ship people off of those islands. So when people visit, like you say, you visiting United States citizens are visiting these other islands or places, particularly if they're not vaccinated. I do know St. Croix got good vaccination. I think they're up over 80%. But people are going, New Zealand, Australia is not totally vaccinated. That's why they're not letting people in. You look at countries that's not vaccinated, like 10 or 12%, and you want to go visit them. They can't protect themselves if you are a carrier. So guess what? If you're vaccinated, you can still carry it to someone else.
And that's I'm so glad you touched on that point, because I think that's where, and obviously national community members, you probably heard me say this before, a lot of you are thinking that because your test was negative 72 hours before that you're all good to go, not understanding that, you could have this virus that doesn't pick up for 7 to 14 days. Right. So in that 72 hours, you go for a week-long trip. You may be back right before that test even comes back positive. But guess what? You were spreading it the whole time. You were enjoying it. And because you're negative, you likely didn't have your mask. You're talking. And then by the time, the citizens who are there, the workers who are there, the essential people who are there, they get ill and affected, you back home. Right. So it doesn't even register on your radar, some of the mess that you've kind of left. So I'm so glad that you really touched on one, the aspect of, this fear factor. Unfortunately, we would think isn't really there. And it definitely sounds like you're the most important, especially that first point you mentioned was this aspect of planning. And that seems to be because you mentioned it quite a few times. That seems to be a huge factor, whether you're going to have a good trip or not, especially when you start traveling, broadly or even just kind of domestically in this country.
Yeah. And two, in January 26th, if you travel internationally and you want to come back into the United States, come back home, you actually have to have a negative test within 72 hours of coming back. So if you're at the resorts, a lot of the resorts have changed it and they know the U.S. and they'll say, okay, what day are you leaving? And they schedule you your test, like the concierge or whoever's in the resort will schedule a test for you. If you're staying at somewhere like an Airbnb or somewhere that's not related, you're going to have to find your own test in the clinic in that locality, which may be hard. And you're going to be paying like $125 to $200 US dollars for that test to get back to get back into the United States. Two, I tell people, you leave this United States, everyone needs medical travel insurance. So everyone think, oh, I have travel insurance. I tick that box for baggage delay, baggage loss, baggage delay, travel delay. Some of it doesn't have a medical component to it. You need to read a fine print on it. You need the medical part of the travel insurance. So first of all, if you test positive and you can't get back in the United States, they're not going to let you board that plane, because you got to have that to board that plane. So you're stuck in wherever you're at for 14 days. So this travel, if you have medical travel insurance, most of them will cover, and they've put the clause in there, COVID coverage. So if you end up being positive, it covers you to stay wherever you're at for 14 days until you can travel back home. But even pre-COVID, I tell people, you never know when you're going to get sick. You never know what's going to happen. And other hospitals don't take your Aetna, Blue Cross, Medicare, Medicaid, Champus. They don't take that. They want a credit card. They want money up front. I mean, even places like I was in Bermuda and my niece had an accident on a moped. We had to give them a credit card for her to even be seen in the emergency department. So that's why medical travel insurance help you, because I mean, you're right. You could be on a moped, an ATV, have an accident. I know one friend, she was white water rafting in Africa, and she went over some rocks, broke a leg. And she not only had to be flown out of that country because they couldn't take care of her. They flew her to South Africa. She got treated, and then she had to be flown back here. But her medical travel insurance covered all that. Because if I need to fire up a medical evac plane, that's automatically $30,000. Yep. That's not even the doctor or the equipment. That's just using the plane.
And it's so funny. Like, it's like, I was just like thinking of a mental picture. Like, imagine if you walked in, especially here in the United States, you walked into your emergency room and they say, "Where's your credit card?" Like, the doctor's not even coming around. It's just some of the things that we really take for granted here, that 1% is not the norm. Do you find a lot of people just like kind of brushing off this whole medical?
Yeah, definitely. Particularly the under 40 crowd, because they feel they're invincible. They really do. And they're the ones that's most adventurous. They're the ones skydiving and jumping and whitewater rafting and doing all this other stuff. Now, some of my older crowds, which I deal with, I shouldn't say older crowd, seasoned, because they do have medical problems. So people have come to me and say, "Hey, I have X, Y, and Z, and I plan on going to this country." And that's what I do as a travel concierge physician. Okay, you're going to this country. So how long are you going to be there? Where are you going to be staying at? What you're going to be exposed to? In case you get sick, let's research some facilities you might need, or these are things you should pack because of your, medical disorder or problem, things like that. People don't realize the American Disability Act does not, and the point is, it said America does not affect other countries. Most other countries, it is hard for disability. It is hard for wheelchairs. It is hard for people walking with arthritis up and down the stone cobble steps, uneven steps, down steep hills. Stairways aren't, measured. That's something that everything's not wheelchair accessible in the world. So people, what did I say? Plan.
Oh, I love it. Before we let you go, one I gotta ask, how many places have you been? Because I know someone in the lunch learning community is probably like, where has she been? Because she look like she's been how many places have you been? In your travel?
Actually, not as many as some of my other traveler friends. I've been to 42 countries.
Wow.
And I've covered 34 of the United States.
Wow. Yeah. Again, I'm not a traveler. I'm just never sure, but just hearing 42 is wow. That's amazing. Absolutely phenomenal. And obviously, before we kind of let you go, right? You kind of mentioned, the fact that you work and you do concierge, you do consulting, and everything else. What? And I always, every time I get my mobiles, I always ask, what kind of led you to say, you know what, I want to do more, I need to do more, and fill that void. What was it? What was the driving force behind that?
Well, like I said, driving force was that I I would go on a couple trips and people would get sick and I would take care of them. Or like even one of them, someone got sick and couldn't get on a plane. So I ended up staying like with her, help her hydrate her up, wrote her fit to fly. I was like, oh, this is real. I could do this. But my other thing is keeping people healthy because people want to travel for not only for experiences, but to learn different cultures. And that's what travel is. Broaden your mind, your worldview about other people live in different cultures. And you want to be able to experience that culture, but stay healthy while you have your travel. So I think that's what led it to. And then I have to stay healthy too.
I love it. So how do people work with you? How do people go on? How do people get into Dr. Yvette's world? Right. Like I know that's a question, that, people, especially because I do have lunch and learn community members who are travel hungry. Again, they see outsides opening up. Hopefully they're vaccinated, especially if you listen to this podcast. Hopefully you're vaccinated, right? Like how can people kind of follow what you do? Get with you, travel with you. Like what's that?
Okay.
What's that process like?
That process. So first of all, if you want to just follow my wellness and travel tips. So I would tell you on all social medias except Instagram. They messed up my account. But anyway, all social media, I am Yvette McQueen, MD. So Facebook, Twitter, LinkedIn, YouTube. I do some YouTube things too. So Yvette McQueen, MD. On Instagram, I am Dr. Travel 911, Dr. Travel 911 on Instagram. But if you want to work with me, if you want to set up an appointment where I do like a pre-travel consultation or even travel with your group, I'm available with that with 6 months planning. You can go to my website, which is YvetteMcQueenMD.com.
And remember, listening community members, all of the links that she dropped and mentioned will definitely be in the subscription, in the show notes. Again, to kind of follow along. Like I said, definitely excited. Can
I say one other quick thing?
Oh, this is your world. Okay. I'm just here.
Okay. If you want to, I call it a doctor in your pocket. Okay. So I recently wrote a book, Travel 911, a health guide for adventurers. So it talks about things you should pack medically. It talks about how to prevent jet lag, and if you get it, or high altitude sickness or sun care, and just it has a little first aid chapter in it too. It also has a diagram of CPR in case you need it. But you can get it on Amazon or at travel911book.com.
Oh, I love it. And, what I love, right, is not only are you putting your knowledge to good, right, you're putting it again. And I can only imagine what that YouTube channel looking like, because I think as a physician, as a person who we're seeing a light, right? I think traveling or just wanting to travel. I think a lot of people, especially last year, got a rude awakening, right? That anything can happen that can change your life, right? Like that could be out of your hands, right? So if you had goals and aspirations like, oh, I'm going to be doing all this traveling, and then COVID comes around and all of a sudden all that is stopped, right? You almost take for granted the opportunities you had to do it beforehand. So I think we're going to see this influx of people who are not going to allow that opportunity to travel to pass them by. But that's why I'm glad you're on the show, because we don't want you to pass on that opportunity, but we definitely want you to do it safely, right? And if you got questions, like if you can't answer questions like what is the healthcare system like, what does the hotels need, your main planning shouldn't be, do I need a COVID test or not? There's so much more detail that has to go into it. And if you haven't done your work and do your due diligence, please get in touch with Dr. Yvette to make sure, because again, we're not here to tell you don't travel. We just want you to do it safely, not only for you, not only for the family or friends you may be going with, but that community that you're traveling to.
Yes.
Right. Because this is again, the pandemic has shown us that this is a worldwide issue, and we need to be really thinking about how all of us can come together to really get the common and greater good. So that's, and I think, I 100%, I'll be honest, I'll raise my hand. I definitely was in that invisible crowd, kind of brushing off the need for travel insurance. I was like, don't have any travel insurance. Right? Like, oh, I'm okay. I'll be good. Like, I'm not going to do nothing crazy. But again, my gallbladder could need to come out while I'm traveling, right? Like, we're not saying like you have to do anything extra, right? Like that would require you to need medical care. Like my gallbladder, my appendix, like something can happen where like I do need to seek medical care. And imagine, right? Like if they say like, all right, where's your American Express card? Where's your visa? Like, like that would just be, and of course I'm like, oh, what? Like, cause again, I'm not in Kansas anymore. Right? Like so we definitely need to make sure we're prepared. So again, Dr. Yvette, first of all, thank you, right, for joining the Lunch and Learn community, getting us hip. I think this is going to be a podcast favorite for a lot of people because they're itching. Again, you probably already know it, but like they're itching to get up out of their house and they're not trying to stay local.
Right. Right.
So Lunch and Learn community, follow her on all her social links, purchase that book. If you're about to travel, which I know a lot of y'all plan on doing, make sure you get a consultation from her. And as always, leave us a 5-star review, podcast, Spotify, wherever you kind of listen to us here on the podcast. Thank you for coming to the end of the episode. It is yours truly, Dr. Barry Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there because your support is so valuable for what we're doing here on the Lunch Learn and everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222, and you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.